When do hearing tests indicate the need for further medical evaluation? Have you ever wondered when a hearing test might suggest that more medical attention is necessary? Hearing tests are vital for assessing how well someone can hear and identifying any potential hearing loss. While many hearing issues can be managed with devices or therapies, certain results from these tests can indicate the need for further evaluation by an ear, nose, and throat specialist or another healthcare provider. Knowing when to seek additional help is essential for timely diagnosis and treatment of any underlying conditions. A standard hearing test, also known as audiometry, measures the faintest sounds a person can hear across different frequencies. It also includes speech audiometry, which assesses how well someone can understand speech. If these tests show hearing loss, the type and degree of loss guide the next steps. There are specific situations where further medical evaluation is crucial. First, if a hearing test shows sudden or rapidly progressing hearing loss, this is a medical emergency. Sudden sensorineural hearing loss can require immediate treatment to improve recovery chances. Next, asymmetrical hearing loss, where one ear has significantly different hearing ability than the other, may point to serious conditions like acoustic neuroma, a benign tumor on the auditory nerve. This situation calls for further imaging and specialist assessment. Unilateral hearing loss, or hearing loss in just one ear, especially if unexplained, should also prompt additional evaluation. This could help rule out structural issues, infections, or even tumors. If hearing loss comes with other symptoms such as dizziness, ringing in the ears, ear pain, discharge, or facial weakness, further medical investigation is warranted. These symptoms could indicate infections or vestibular disorders that need attention. In cases of conductive hearing loss with no obvious cause, medical evaluation may be necessary. This type of hearing loss can stem from issues in the outer or middle ear, like infections or fluid buildup, and may require medical or surgical intervention. Another red flag is poor speech recognition scores during testing, even with mild hearing loss. This could suggest problems beyond the cochlea that need further investigation. For children, any confirmed hearing loss should lead to prompt medical evaluation. Early intervention is critical for their speech and language development. Lastly, if hearing tests show changes possibly linked to medications or systemic conditions like autoimmune disorders or diabetes, a medical evaluation is important. This helps manage overall health and adjust treatments as needed. Regular hearing tests are key to monitoring hearing health and catching changes early. If any of these concerns arise from test results, a referral to an ear, nose, and throat specialist or an audiologist is essential. Early diagnosis can lead to effective treatments that may restore hearing, prevent further loss, or address serious underlying issues. In summary, hearing tests indicate the need for further medical evaluation when they reveal sudden, asymmetrical, unilateral, or unexplained hearing loss, poor speech recognition, associated symptoms, or when hearing loss occurs in children or in the context of other health issues. Timely medical assessment is vital for appropriate diagnosis and management, helping to preserve hearing and overall well-being.